Hi friends! Today we're going to be talking about our wrists and forearms. To start, let's go over the anatomy. And so our wrists are made up of 8 little tiny bones that are called carpal bones. And then it interacts with our forearm, which has your radius on your thumb side and then your ulna on your pinky side. On the back side of your arm, you have your forearm extensors and your wrist extensors, so your ability to bring your palm back. And then on the front side, you have your flexors. In pole dancing, we use our gripping, flexor muscles a lot more than we use our extensor muscles, and so these have a tendency to be stronger than our wrist extensors. When we're talking about actions that our forearm can do, we need to take into consideration our elbow and our wrist, and then since our upper extremity is all connected, our shoulder as well. I've done other videos about shoulder mobility, and so be sure to check those out, but just know that sometimes when we have mobility restrictions in our wrist, we can feel it in our wrist. Sometimes we'll feel it in our elbow or in our shoulder, so it's important to evaluate your entire arm to make sure that we're not just having pain in one area, but really the issue is somewhere else. So if you have questions about that, feel free to reach out and we can do a quick consult to see if we can figure out what's going on with your body. So wrist movements, we have flexion going up and then extension going back. When we go towards our thumb side, that's called radial deviation. If we go towards our pinky side, that's called ulnar deviation. And we have normal ranges of motion that we're expecting for all of these, and then they shouldn't be painful. For our elbow, we have flexion and then extension. And then we also have supination, which is when our palm is facing up. And then we have pronation when our palm is facing downward. So this ability to rotate is called supination and pronation. For our muscles, there's a bunch of different muscles that make up our extensors that go all the way across. So we have our extensor bundle, and they all connect right here on the outside of your elbow. And then our flexor muscles, there's a bunch of them as well, and they all connect on the inner part of our elbow. So depending upon the motion that you do a lot, you can have more symptoms, like usually pain on one side or the other of your elbow. They're commonly named golfer and tennis elbow because of the motions that are repetitive in those sports, but they're not only occurring in tennis and golf. So when we're talking about wrist pain, especially when it comes to a few different motions that we do a lot in pole. One is a bracket grip, right? So we have our pole that push down, that push-pull variation, and then in a plank or push-up position. So let's start with our plank position. We need to have 90 degrees motion in our wrists to be able to access that plank position perfectly. So if you put your forearms together and then pull them back, is it flat? And you can see that mine are not, and it looks like this side is a little bit more limited than the other. And then to do that bracket grip, we only need 30 degrees, and so if you're able to get to hopefully you're able to get past 30 degrees, so that position isn't being limited by your wrist mobility. So let's say you're like me, you don't have full 90 degrees and you want to work on improving it. Here are some things that you can do. Okay, friends, so we figured out that we have some wrist mobility restrictions, and so we're going to work on lengthening our muscles and mobilizing our wrist joints. So to start, we're going to bring our fingers towards our knees, palms on the floor, and then lean back. We don't want our fingers to come up, and so you may be here, and wherever you are is just fine. We're all on our own little mobility journeys. So hang out here for a minute or two. I'm not gonna film the entire minute because I feel like that'd be really boring to watch, but hang out here, keep breathing. As it starts to feel less stretch, you can tip yourself back a little bit more, and then slowly release when your time is up. Next, we're gonna work on applying some mobilization to our right where our carpal bones and our like radius and ulna meet. And so we're going to use the like thumb part of our hand, and we're going to put that right where our wrist bends. We're going to apply some force backwards and a little bit down, and we're going to lean forward over it and twist very gently. And then come back, reset, apply a little force. Make sure to do both sides if both sides need improved mobility. Next, we're going to do some active work for our flexors. So we're going to keep our fingers nice and flat, and we are going to lift up and then very slowly lower. And lift up and lower. Awesome. So we're working on, those are working on the flexors, and now we're going to work a little bit on our extensors. And so we're going to make fists, extend our wrists, open our fingers. Close the fingers, roll back to neutral, extend up, curl our fingers, and don't be surprised if this one is actually pretty hard. Boom. Sometimes our nervous system is what is limiting us in being able to access that entire range of motion. And one of the ways that you can check this is to see if you have the ability to passively get into that range of motion, right? So if you look at my active, it's a little bit better than it was before, but it's still like not 90 degrees. But if I like relax and don't muscle through it, I can get farther than I can actively. And so we're going to work on just telling our brain that we're safe in that position, which can be the nerves that run on the front side of our arm not having enough stretch. And so we're going to just stretch them a little bit. They're called nerve glides. And so we're going to bring our arm out to the side. And you can play with how far back this arm is where you feel a stretch. But we're going to tip our head down and at the same time extend our wrist. And back. Do like 10 of these. So that's for your median nerve. Another one is for your ulnar nerve. And I remember doing this as a kid, and I always thought it was really funny, and who knew that we were actually like stretching our nerves when we were a kid. We're going to make little circles. We're going to bring our arm up, and we're going to make the weird face. So I don't get my glasses all dirty. Fingers out, up. You shouldn't feel any like zingy sensations with either one of these, but you should feel like a mild stretch. Same thing, do 10. And for our last nerve of our forearm, it's our radial nerve. And I like to call this one sneaky money. So someone's gonna hand you money and you're gonna sneak it back to somebody. Give me the monies, and we sneak it back. Once again, let's do like 10. And then let's reassess where we were at the beginning. Forearms together. And I only did my right side. And I'm gonna see if I can screenshot where I started and where I ended. Give it a shot and let me know how it goes. Hi friends, one quick add-on to this. This wrist mobility routine is something that you're going to need to do on a regular basis if you're wanting to improve your wrist mobility over long term. There are not, as much as social media makes it seem like, there is like 3 exercises that you can do to improve your wrist mobility or your back pain or whatever, and then it's just gone forever. Our bodies don't work like that. It takes like progressive overload and like time and repetitions for our body to see changes. And if you think about it in like any other sort of movement thing, like it's not like you can run once and then you're just in shape for the rest of your life, right? Like you have to consistently run to maintain your cardiovascular health. And same thing with our wrist mobility. You have to do your wrist mobility exercises on a regular basis to keep the mobility that you have and then slowly improve it. I also would like to point out that some of these exercises I would not do as a warm-up. I would have my mobility training be separate than my warm-up. The main one is that static hold where we're like this. Static stretching prior to activity has shown to decrease strength and decrease flexibility, and so I strongly suggest that across all of the things that you do that you don't static stretch prior to working out. And if you have questions about that, let me know and I can make a whole nother video. But as we're getting ready for activity, we want to have our body be moving in a dynamic fashion, not just hanging out in stretches. Let me know how your wrist mobility goes, and if you have any questions about anything that you have going on in your body, let me know and I'll try to help you.